Good morning, everyone. The topic for today's discussion is the root canal. Coming to the component of the root canal system, the entire root canal consists of the pulp chamber, the pulp horns, and the pulp or the root canals found in the anatom. So, the parts of the root canal includes the pulp horn, the pulp chamber, the root canals, the apical foramens, the apical deltas, the accessory foramens, and the accessory root canal. Coming to the apical deltas. The apical deltas are the area where they contain the maximum number of microorganisms. This apical delta, usually they are present in the apical one-third of the root. They are in the shape of a delta, hence they are called as the apical delta. The accessory root canals. The accessory root canals are usually present horizontal to the main root canal system. The accessory root canals usually harbor the communication between the pulp chamber and the periodontium. They help in the transmission of infection from the root canal system to the periodontium. There are different types of lateral canals. There can be either a furcation canal, or there can be a furcation canal, or there can be a canal which is present horizontal to the main root canal system called as the lateral canal. The classification of the root canal systems. The root canal system can be classified into 8 types. Type 1, where we have a single root canal. Type 2, where we have a single orifice which divides into two and forms as a single canal and leaves the root canal system as a single. Type 3, we have single root canal dividing into two and it forms a single canal and leaves the root canal system as a single. We have the type 4 root canals, where we have two different canals, leaves the root canal in a two different orifice. We have the type 5 root canals, where we have a single root canal divides into two and leaves the root canal system as two different canals. We have the type 6, where we have two different canals, forms as a one and forms as a single canal, and again bifurcates as two in the middle third and leaves the root canal as two different orifices. In the type 4, we have the type 7, where we have the single root canal bifurcates into two, forms one and again leaves the root canal system as two different orifices. Type 8, we have three different root canals. Coming to the apical constrictions, the apical constriction basically contains of three important landmarks, that is the apical foramen, the apical constriction, and then we have the cemento-dentinal junction. So coming to the apical constriction, the apical constriction is the smallest diameter of the root canal system, where the cleaning, the shaping, and the disinfection ends. The apical constriction is also called as diameter. The cemento-dentinal junction is a portion where the cementum and the dentin meets. It is a point where the pulp tissue ends and the periodontium tissue begins. The cemento-dentinal junction is usually generally the same area as the apical constriction, and it is 1 millimeter short of the foramen. So this is the minor apical diameter, and this is the major apical diameter. The minor apical diameter is also called as apical constriction, whereas the major apical diameter is also called as the apical foramen. Coming to the root canal anatomy of the individual tooth. First, the maxillary central incisor, which has got a root length of 22 millimeters, the widest root canal, and it has got a single root with a single root canal, and the access cavity preparation in this tooth is usually triangular in shape. This is the access cavity opening for a maxillary central incisor. Next, coming to the maxillary lateral incisor. The maxillary lateral incisor has got a single root with a single root canal, and there's a small dilaceration seen at the apical one-third. The access cavity preparation for a maxillary lateral incisor is triangular in shape. Coming to the maxillary canine, the maxillary canine is the longest root with a root length of 28 millimeters. It has got a widest root canal, wider root canal, buccolingually rather than mesodistally. Again, the access cavity will be either triangular in shape. Coming to the posterior teeth, that is the maxillary first premolar. The maxillary first premolar has got a two roots with the two different root canals. The two roots are present either in the buccal or it's present buccal and palatal. The canals are buccal and the palatal canals. The axis cavity preparation will be in a buccal lingual direction, and the root canal orifices are two in the buccal and lingual direction. So this is the location of the root canals, that is in the buccal and in the palatal direction. Coming to the maxillary second premolar can have a single root with a single root canal. It can have two different roots with two different canals, or else it can have a single root with the two canals. Again, the canals for the maxillary first molar. Maxillary first molar has got three roots with three root canals. The three root canals are the mesobuccal, the distobuccal, and the palatal. There are variations seen in the mesobuccal canal. That is, there can be a second canal located in the mesobuccal cusp, that is the MB2 root canal, and usually in 22% of the cases there can be a formation of a mesobuccal canal. And the axis cavity preparation will be rectangular in shape. So this is the position of the canals, that is beneath the mesobuccal, the mesolingual, and the this is the mesolingual, that is the palatal canal, and then we have the distobuccal root canal. Maxillary second molar. The maxillary second molar will have three root canals with three roots. Coming to the mandibular teeth, the mandibular central incisor has got a slender root, maybe a root length of 20 millimeters, and it has got a single root canal. The maxillary lateral incisor has got a single root canal, or else it can have a single orifice which divides into two root canals at the middle third and leaves the root canal system as a two different orifice. Both in the maxillary central as well as the lateral, the axis cavity will be triangular shape. Coming to the mandibular canine, the mandibular canine will have a single root with a single root canal. The mandibular first premolar will have a single root, or else there can be a variation where there can be a single orifice, then the canal dividing into two, and then again it forms a single canal and then leaves the orifice as a single canal. Coming to the maxillary second premolar, the maxillary second premolar has got a single root with a single root canal. So, both for the maxillary first premolar and the second premolar, the axis cavity will be in a buccolingual direction. The canals will be present in the center of the tooth. Only what we have to take into consideration is the lingual inclination of the tooth, and we have to check for the long axis of the tooth when we prepare the axis cavity. Coming to the mandibular, this is the axis cavity preparation for the mandibular premolars in the buccolingual direction. Coming to the mandibular first molar. The mandibular first molar has got two roots with three root canals. The three root canals will be the mesobuccal, the mesolingual, and the distal root. And sometimes there can be a distolingual root canal. So the axis cavity preparation, if it is a three canal, will be triangular in shape. If it is a four canal, it will be rectangular in shape. So this is the location of the different canals, that is the mesobuccal, beneath the mesobuccal cusp there will be a mesobuccal canal, beneath the mesolingual cusp there will be a mesolingual canal, and in the center there will be a distal canal. Now if there are four root canals, then mesobuccal, mesolingual, then the distobuccal and the distal. Coming to the mandibular second molar, the mandibular second molar will have two roots with three canals, or else there can be a single root with a C-shaped root canal system where the mesial and the distal canals meet to form a C shape. So this is how we do the axis cavity for to locate the canal.